child is born, someday they'll be full of hopes and dreams. It won't be very long till they move out on their own, 'cause that's the way that life's supposed to be. But something isn't right, there's a lost look in their eyes. They're crying out, why can't you just see? I'm in here when the joy turns to crying. See the world through my eyes for just a moment in time. I'm in here, oh don't you know I'm trying to find a way to show you who I
Children with autism are some of the hardest working kids around. They often struggle to communicate, play, and socialize. They may tantrum frequently and engage in unusual behaviors, such as rocking or flapping their hands. Although this epidemic is on the rise, there is good news. Many children can make significant gains through specialized types of teaching developed from the field of applied behavior analysis, or ABA. In order to reach their full potential, children may receive up to 40 hours a week of this intense intervention. After years of rigorous work, some children have improved enough that they no longer qualify for a diagnosis of autism. These children can be fully integrated into typical classrooms and develop meaningful friendships. Even when children do not lose their label of autism, they can make amazing and life-changing gains. Unfortunately, these gains come at a cost. This type of intense teaching is not typically available in public schools, nor is it funded by insurance companies. Instead, families are left to foot the bill at the expense of their savings, retirement accounts, or even their homes. This is Jamie McGilvery from Beaumont's Hope Center. Today on Spreading Hope, you will learn more about behavioral interventions developed from the field of ABA and some of the ways families access this treatment in Michigan. We'll take you to a rally for insurance coverage in Lansing, and Dr. Lori Warner will introduce you to a dedicated autism insurance advocate who is fighting to educate our state legislators about the need for insurance to cover these essential treatments. Applied Behavior Analysis, or ABA, is a specialized field within psychology. When I tell people I'm a psychologist, they often think my job entails listening to the woes of others. Actually, my job is much more akin to the super nanny. I teach parents how to use concrete techniques to change their children's behaviors. In fact, the motto of ABA is that behaviors can be changed. When we look at children with autism, we see that their disorder is made up of many different behavioral characteristics. Some skills they lack, such as communicating, socializing, or playing with other children. Some behaviors they have in excess, such as tantrums or aggression or repetitive behaviors. ABA interventions can be used to teach the skills that are lacking, but they can also be used to decrease the behaviors that parents dread the most. Here we see Emily, a tutor working with Nolan, a child that's been diagnosed with autism. The type of teaching she's conducting is called discrete trial teaching, or DTT. DTT is not always at a table, and it should be fun and engaging as well as teaching core skills. This type of teaching is typically adult-led, meaning the adult sets the pace and picks the skills to teach. But the rewards are always tailored to the kids. The most important part of any behavioral intervention is capturing motivation and making learning fun. Also, children with autism learn best through repetition and consistency. At times, it's necessary to work on teaching them to sit and attend. In the earliest stages of therapy, many children are simply learning how to learn. Many parents report that their children have the ability to show a variety of skills, but they do so only on their terms. When given an instruction, a child with autism may ignore the request, or worse, begin to tantrum. In order to decrease these behaviors and increase the child's ability to follow instructions, parents are taught to give one instruction, immediately guide the child to follow the instruction, and provide a reward for doing so. In repeating this sequence, children learn to listen the first time, and they come to enjoy complying because there is a reward for listening. Over time, the parent decreases the amount of help they provide, and the rewards are praise or social acknowledgement. I'm here today with Denise McQuillan, and she's graciously invited us into her home to show us firsthand what her son Nolan's ABA home program looks like. Hi Denise, thanks for joining us.
Hi there.
Can you tell us a little bit about Nolan? When was he diagnosed?
He was diagnosed at 29 months, and he's now just slightly over 4. I'm sorry, I can't do the math that quick on the months. So he was then in the gift program 4 months after that.
So you immediately sought out services. You sought out ABA services.
We were actually referred by our pediatrician, which to this day I'm so grateful for that that's the direction he immediately pointed us in, and we started right away.
That's great. Now tell us, what did it look like? What did Nolan's program look like in the beginning when you first started?
It was very, very basic at first because he wasn't communicating at all. He wasn't pointing, he wasn't seeking us out for things. So we basically started right at the beginning with visuals and a lot of imitation and the sign language that I know a lot of parents are a little averse to at first, as was I, and it just took off from there.
And so how many hours a week were you doing with him?
We were in the program, so it was about 20 hours, I believe, some give or take a few. Some days we got a few more in, and some days we had to cut back a little bit, but that was about the average.
Okay. Now, before you started ABA, you said Nolan didn't have a lot of language and none. And so tell us a little bit about what he's doing now.
Oh, it's night and day. I even tell his teachers all the time, a year ago, he wasn't even speaking one word or pointing, and they're just amazed. He's his programs are totally flip-flop, so now they're more verbal, less imitation, less visual, although we, still do incorporate all of that. His vocabulary, he's probably at about 100 words. He spontaneously asks for things. He seeks us out now. Look, Mom, with his brother, he stop, It's a little more normal, atypical sibling rivalry going there, yeah.
So overall, would you say ABA has not only changed the quality of Nolan's life, but your whole family's life?
Oh, absolutely. Because when we first got the diagnosis, we felt so helpless. Like we weren't empowered to help him. And once we started doing the program and we saw the benefits, we just stick to the plan because we see the results and it gives us the tool we need. And there's less stress in the family. We incorporate his brother into it. So it's just, we say Team McQuillan, and that's how we approach it. So it's really, really helped him.
That's great. I think his outcome is really a testament to your hard work.
Oh, thanks. And him too. I mean, that poor little guy works his little rear off.
How many hours a week is his program now?
Well, now we have him at about 10 to 12 hours, but we also have speech, we have physical therapy, and he was in preschool. So he didn't get a day off, and we just kept to the program as close as we could and then tried to have it generalized into his other programs. And we tried to keep them all kind of in the same pace, and most of the time we're trying to keep up with him.
Sure. He's a busy guy. Well, thank you so much for sharing Nolan's story. It's really an inspiration.
Sure. Thanks for being here, and thank you so much for the Hope Center.
In addition to discrete trial teaching, or DTT, behavior therapy can also be more child-led and capitalize on those natural learning opportunities that are around us every day. When using techniques of ABA to teach, each child has a curriculum that is individualized. Some children may be in the beginning stages of learning to talk, while other children may be learning how to hold a conversation with a group of friends. Some types of skills lend themselves to more structured or DTT-type teaching, while others work best in a very naturalistic environment. Either way, it's still ABA, if it is based on behavioral principles of learning and it uses data to guide programming. Data collection is one of the key elements to using ABA. We take data on everything that we do. This is because taking data is the only reliable way to tell us if our intervention is working. If it's not, then we find a way to fix our teaching. You would never hear a behavior analyst say, "This child simply cannot learn this skill." If the data tells us that a child is not making progress, we may break down a skill into smaller components or find a stronger motivator. We always have a trick up our sleeves to speed up the learning process. Years of research tell us that ABA is the most effective teaching intervention for children with autism, and we have the data to prove it. It's clear that ABA has been life-changing for so many children and their families.